Hi, I'm Alicia de la Torre and I'm working for Steria. The Steria Group delivers IT services to help organizations in both public and private sectors operate in a more efficient and profitable way. Steria supports and implements solutions in the healthcare sector that help professionals to provide a high-quality healthcare treatment to the patients. Now, I will leave one of my colleagues make a demonstration on one of our solutions within the healthcare sector.
The name of the solution is the First Line Doctor-Patient Demonstrator. It's based upon the Microsoft Surface touchscreen and the Microsoft Windows 7 phone to communicate between the doctor and the patient utilising the Azure cloud system. The benefits of the solution are that the doctor can always be in contact with the patient, and the patient can always be in contact with the doctor on the move with the mobile phone. So in this scenario, the patient is feeling ill, so he takes his Windows 7 mobile phone and opens up the patient application. He then chooses to pick an appointment for the doctor. He is presented with the default doctor screen, but he may not want to see this doctor, so he may want to go to the Bing Maps on the telephone and choose another doctor to visit, one nearer to his location. In this scenario, we will pick his default doctor. Once the default doctor is picked, we will pick the appointment. This screen comes up with all the appointments and the availabilities of the times of that doctor. In this situation, we're going to pick 5 o'clock for the appointment visit. We validate the appointment, and then this is sent to the doctor's system on the touchscreen. So as we can see, the doctor's system has now indicated that there is an appointment available. The doctor can then view this by clicking on the diary button and reviewing his appointment list for the day. In this situation, the patient is now at the doctor's office and the doctor is ready to diagnose and prescribe. The doctor will utilise the electronic ID card to log into the system. He will then find the patient that he is about to see through the list of appointments for the current day and select that patient. Once the patient is selected, he can now be dragged onto the Surface. But before any details are seen about the patient, we need the doctor to ask whether he can view the patient's records. Once the confirmation is made, the patient is asked for their BEID card. He will then authenticate to allow the doctor to view details about this patient from the Health Vault. The basic information that's shown is from the Health Vault system and just shows some very basic measurements regarding the patient on this screen. The doctor can also review any documents or x-rays that the patient has and utilise these to make any further diagnosis to the patient's condition. The doctor can then prescribe medication to the patient. The doctor will ask the patient several questions and decide on the particular ailment the patient has. He will then ask questions regarding the area of the ailment, and these will be then utilised to give answers. The answers given in this screen will decide on the list of drugs available for this particular ailment. The doctor will then pick the specified drug for the patient. He will then get a recommendation of how much the patient should take of this type of drug, and then we send the prescription to the patient's mobile phone, and this will send a prescription to the telephone. The patient now receives the prescription through the mobile phone and can take this to any pharmacy who can basically scan the 3D barcode and dispense the correct medication to the patient.